Medical Dialogues. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Foregoing one food treats eosinophilic esophagitis as well as excluding 6 fine study. Eliminating animal milk alone from the diet of adults with eosinophilic esophagitis or EOE is as effective at treating the disease as eliminating animal milk plus 5 other common foods, an NIH-funded clinical trial has found. For people with EOE whose disease remains active after they forego animal milk, a more restrictive diet may help them achieve remission, according to the researchers. Now, EOE is a chronic disease characterized by an overabundance of white blood cells called eosinophils in the esophagus. The new findings come from the first multi-site randomized trial comparing the 6 FED with a one-food elimination diet or 1 FED in adults with EOE. The trial involved 129 adults aged 18 to 60 years with a confirmed EOE diagnosis, active EOE symptoms, and a high number of eosinophils in esophageal tissue. Participants were assigned at random to either the 1 FED, which eliminated only animal milk from the diet, or the 6 FED. They followed their assigned diet for 6 weeks, then underwent an upper endoscopy exam and an esophageal tissue biopsy. Obesity in pregnant women could increase risk of poor health outcomes for both mother and the baby, finds new research. Maternal obesity alters the structure of the placenta more than gestational diabetes mellitus or GDM. The new insight, published in the Journal of Physiology, enhances understanding about the mechanisms underlying poor pregnancy outcomes and the subsequent greater risk of poor neonatal and offspring health. The identification of specific changes in the placenta could lead to the potential development of future placenta-targeted treatments or screening tests that may improve the health outcomes of the mother and offspring, particularly in low-middle income countries. The research conducted by scientists in South Africa in alliance with those in England is the first study to investigate the effects of maternal obesity and GDM simultaneously, and to be carried out in a low-middle income country where obesity and GDM during pregnancy have a substantial health and economic impact. Study finds loneliness to be central to perinatal depression. Loneliness can often contribute to depression in expectant and new mothers, finds a new review of evidence led by UCL researchers. The findings suggest that increased support from family and healthcare professionals can be helpful in reducing the mental health impacts of loneliness. Published in BMC Psychiatry, the meta-synthesis of qualitative research pulled together accounts from 537 women from 27 research papers on 4 continents. Some of the causes of loneliness included stigma, self-isolation, emotional disconnection, and not receiving enough support. Many women reported a fear of judgment as a bad mother and both perceived and experienced mental health stigma, which contributed to them hiding symptoms of mental ill health and often led to self-isolation and withdrawal. Childhood obesity is linked to increased risk of 4 of the 5 newly proposed subtypes of adult-onset diabetes, finds study. New research by Swedish researchers published in Diabetologia shows that childhood obesity is associated with an increased risk of 4 of the 5 recently proposed subtypes of adult-onset diabetes. In 2018, a groundbreaking study identified 5 novel subtypes of adult-onset diabetes, which are severe autoimmune diabetes or SAID, including type 1 diabetes and latent autoimmune diabetes in adults, which is LADA, and 4 subtypes of type 2 diabetes, which is severe insulin deficient diabetes or SIDD, severe insulin resistant diabetes or SIRD, mild obesity related diabetes or MOD, and mild age related diabetes or MARD. SIDD, SIRD, MOD and MARD are currently collectively classed as type 2 diabetes. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.